Welcome back, Kingdom Warriors, to the Growth Lab, where we are growing our mind, our muscles, and we are growing in life. Okay, I know I've been MIA with these videos, but you know that's life sometimes. Okay, I'm only human. All right, but anyways, I want to talk about how my nursing journey has been going, because maybe there's somebody out there that's watching this right now and is in the process of going through the same journey, or is interested in it, or is just wanting to watch. So let me share my experience. I'm not sure if many of you know already, but like, I am a registered nurse. I'm working on a surgical care unit at a hospital, and I'm in the registered nurse residency program. So with this program, it's like a year long, and for the first 2 months, I'm with a preceptor, and they're guiding me and like showing me how the unit and the flow of the unit and everything like that. But now I'm on my own, because the 24 shifts, 2 months have been up. So this is my fifth shift on my own now. This last shift was probably the most challenging out of all the shifts, all the 5 shifts that I had by myself, because there were two really critical, actually all three of my patients were pretty sick. Like, I needed to be monitoring them. Like, one had a blood transfusion that in the morning, so I was just making sure like that person's blood pressure was fine. Another person had full spinal precautions. Their potassium was high. They had a freaking foot IV, so then I had to like make sure orders were put in for that. And then the other patient was an AFib RVR, and that's atrial fibrillation with like a rapid ventricular heart rate. And so it was just a lot for me. And that was a lot. It was a lot, but it taught me a lot too. So grateful for that shift, but also I could have done without it, but it's okay. But nursing, I just wanted to say, like, I wanted to come on here and say this, is that nursing is a pretty crazy, like, career, because it's like you step into one patient's room and they're having like the worst time of their life. Like, they kind of want to just call it quits, and rightfully so, because like, if you just got an NG tube and the doctors told you like the day before that you were probably going to be discharged and leaving the hospital, and then all of a sudden you start feeling worse, and then you have to get a tube in your nose and your heart rate starts going crazy and you don't feel good, and then people are poking you because we lost IV access, so now we got to get another IV. So I don't blame you. Like, I don't blame you. But it's crazy because you step in that patient's room, they're like not feeling good, like in pain, and then you go to another patient's room and they're like chilling, they're sitting on the couch, like just going about their business, eating their dinner, chilling, and then another patient over here, little Susie over here, just passed away, a couple weeks, like hours ago, and their family is grieving, so it's like, what? And then little Jimmy over here is happy because he's leaving tomorrow morning, and he already got his stuff packed, so it's like you're walking into so many different people's lives, and it's just crazy to see, and it's a lot, like, mentally, a lot to take in mentally, and you're taking in a lot of different emotions as well. So like, if you're thinking about going into this type of profession, this type of career, just keep in the hospital. I'm speaking for the hospital standpoint of it, because just keep that in mind, because if you're one to like really absorb everybody's emotions, you're an empath, and that really affects you, you might be drained. So you have to find extra ways to relieve that stress when you're not working. Find ways to fill your cup, because how are you going to fill other people's cup when you don't fill your own cup? And ways to really self-care and even connect with, like, first and foremost, connect with God. Like, that's going to be the key here to really persevere and push through, because this is a spiritual type of work. And for me, like, that's how I see it, you know. In any job you work in, side note, any job you work in, work as if you're working for the Lord, because it'll change your perspective on how you're doing your work and your why of why you're, you know, going hard at work, or why you're trying to give the quality, provide quality care, or provide quality whatever. You'll look at it a different way. Your perspective changes, so keep that in mind. But I just want to share this a little bit today and update you guys on how it's going, because it's going good. It's just a lot to take in, a lot to learn. But you know what? You just have to tell yourself, like, with God, I'm able to do all things. I'm able to do all things, humbly speaking. And you can. It's how we frame our mind and what we say to ourselves becomes our reality. All right. So if you're listening to this today, please take that in, because it is so true. And if you want your circumstances and your situation to change how you view things. View it from a God perspective, and really tell yourself day in and day out positive words and affirmations, and God's truth, because that's how you're gonna start seeing a difference. All right. So thank you for tuned in to this little, message for today, but I hope it resonated with you, and I'll see you in the next video.